Okay, I've reviewed my physician's orders for an IV push of furosemide for my patient. What I'm going to do is go ahead and make sure I have all of my stuff. I have my gloves, I have my alcohol preps, I have my syringe, I have my flush, I have my furosemide, 2 milligrams. And what I'm going to do is I'll go ahead and wash my hands before I perform medication administrations. I'm going to follow the 6 rights of medication administration, which is time, route, amount, medication, person, and documentation. So what I'll do is I'll go ahead and check if my furosemide, look at my orders, my patient is running on normal saline. So I'll check and my furosemide is compatible with normal saline. So what I'll do is I'll go ahead and this is my furosemide. Clean the top. I'm going to pull 2 mils of air. I will inject that into the vial. I'm going to make sure it's 2 full mils. And no bubbles in the line. Alright, that is cool. Got that. I'll do the scoop method. I just drew up 2 mils of furosemide, so I will get my label. I will label my medication. My patient does have the IV line ran, so after all that is done, I'll dispose of these gloves. I'll enter into my patient's room. Good afternoon, my name is Marlon Howell. I'll be your student nurse today. Can you state your name and your date of birth? Patient states his name and date of birth. I ask him if he's allergic to anything. He says no, he is not. So I make sure and check his IV line that he does have normal saline running through. He does. I'll explain to my patient I'm here to give him his medication of furosemide that the physician ordered. I'll wash my hands again just to be safe. I'm going to put on my gloves. Alright, now since furosemide is compatible with his IV line, I do not have to flush. But what I will do is I'll go through and I'll check the patency of the line. It is intact and it is fusing properly. He claims there is no complaints of pain, erythema, or redness. So what I'll do is I'm going to go ahead and get my labeled medication, take the top off of it, and I'll get his line, make sure it's good. Alright, now I'll tell the patient I'm going to begin to infuse. So I'll get the alcohol prep. And I'm going to clean his line, maintain asepsis technique, and I'm going to connect the medication to the port. Now, since this is compatible, I don't have to flush it, but I will use the push-pause method, which if he has 2 milligrams, then it's 1 milligram per minute. So as I push and pause, I'll push some more and pause, and push some more over a period of 2 minutes. Now that it's complete, make sure the IV line is still flowing good. Now, if this was not compatible, what I would do is I would clamp this line down with his IV line still infusing. I will get my flush and I will make sure to clean the line. Very good. I will keep it clamped. I'm going to connect my flush. I would make sure to flush it all the way. This has completely flushed. Now it's time for the medication. I'll explain to him I'm doing his furosemide. I go through and I connect it, and I use the furosemide 1 milligram per 1 minute over 2 minutes. Push, pause, push, pause. Now I'll make sure it's, since it's not compatible, after this I will make sure to flush it once more. So I flushed all of it. It won't go in. I'm flushing it. Alright, and that is complete. Ask the patient how he's feeling. He says he's feeling fine. Now I'll let the IV tubing back in, set the drop factor to what it is. Set the drop factor to the remainder of what it was. If this was an INT adapter, I will make sure to ask the patient how it is. And he says there's no pain or anything. I'll connect. I'll clean it off really well. I'll get my flush. And I will go through and I'll make sure not to force anything through the INT line if it is not going. But this is going. So I'll flush it. Patient says he feels fine. I'll get the medication. After, I'll just clean it one more time to be safe. I'll connect the medication. I will push over a period of 2 minutes. Alright, that is done. And I will also clean it once more. And I will flush it one more time. And that is it. And I would document everything that I've done. Ask my patient how he's feeling. He said he's feeling fine. And that is it. That is the end.